Of today's kind of journal article review is mostly to look at the issue of CBD and how it can be used as a therapeutic benefit to a variety of different populations, particularly in the psychiatric realm or the psychological realm. People that struggle with different psychological conditions, anxiety, sometimes schizophrenia, and I have a particular interest in the autism population. So that's why, I wanted to really study CBD, and I really appreciate you, Hannah, kind of getting on board to look at some of the literature about how CBD can be effective in this population, how CBD is derived, the endocannabinoid system. And as you may know, just recently, Texas has passed a law for which, under the Compassionate Care Act, CBD can be prescribed starting later this year, inshallah. That CBD can be prescribed for kids with autism and different other conditions as well, including a variety of other types of epilepsy. It was approved, FDA approved nationally for very specific types of epilepsy conditions, the Dravet syndrome and Lennox-Gastaut syndrome. And so I really kind of appreciated you going and selecting this fascinating article on CBD. Let me pull that article up right now. And I think what we can do is just have I'll just overview what you'll be talking about, and we can kind of have a brief discussion about this article. So here we go. So this is the article from the Medicines Journal on, and it was just published at the end of 2018, so not even a year ago. And there's some, the authors are from Italy, but also from the NIH. And so it's a nationally recognized article, and the authors are well recognized worldwide. And I really liked how you kind of laid out and summarized the article from the use of cannabis in its treatment of psychiatric disorders, the endocannabinoid system, the phytocannabinoid system, and how it relates to the endocannabinoid system, its application of cannabinoids in schizophrenia, in anxiety syndromes, and also depression. So you want to just go ahead and get started and talk a little bit about, and we can discuss this really fascinating article, Hannah?
All right, okay. So I kind of started off with the history, because I thought it was important for us to understand kind of where we were at with cannabis, like what we were using it for previously, and then kind of what the mindset of, the whole thing with cannabis now. So it started around 2700 BC, where it was being used for things like constipation, malaria, things like painful menstruation, and then in around 1000 BC, it became very widespread in India for a lot of different things as well. During the 19th century, just different parts of the 19th century, we had different kind of doctors, psychologists, psychiatrists. They were kind of looking at uses for it for mental disorders, as well as for things like muscle spasms and rabies, epilepsy. It wasn't until the 20th century where it became more of a recreational use rather than for for medicine and for healing purposes. So that's why people kind of took a step back. And then around the 21st century, that was when people kind of brought it back and were like, okay, maybe we can use it for therapeutic purposes. So then, sorry, go ahead.
No, that's exactly right. So I think a big part of the attraction to cannabis, there's a lot of interest in the 1970s for recreational use, and it's the hallucinogenic components of cannabis. And we'll get into the chemical makeup, just a basic 101 overview of the chemical makeup of marijuana and cannabis and the plant, basically. And so lately, people are drawn to the idea of using more plant-based or quote-unquote natural approaches to medications and mental, psychological, medical conditions. Could there be a natural plant-based approach? But at the end of the day, there is very much chemical reactions that are going on, whether it's synthetic, like man-made chemicals, or if it's a plant extract, like in cannabis. So go ahead, yeah.
Okay, so then I kind of touched in on the chemistry of cannabis. And so the plant overall contains 483 compounds, and out of those 483, you have 120 that are bioactive. These are known as the phytocannabinoids. And then the ones that are kind of most specifically focused on, especially when it comes to like therapeutic purposes, is the cannabinol, I think I said that right, and then the cannabinol, which is the THC and the CBD. And the THC is, they kind of found that that one had to do more with psychoactive, so kind of psychosis and stuff like that. And then CBD, it was more the more therapeutic part of it. Like that plant was more of the one that kind of provided the therapeutic and kind of helped to like reduce anxiety and help with stress and stuff like that.
Yeah, so just let's get into that. So there's in the body, there's the endocannabinoid system, as you've kind of outlined here, where there's the cannabinoid receptors that exist in different portions of the brain, and everybody has it to varying degrees in different parts of their anatomy. You know, in the amygdala and the cingulate cortex. So different portions of the brain have these cannabinoid receptors at the neuronal level, at the presynaptic side, particularly, and it's part of that neuronal transmission regulation. You know, the stimulation of an action potential when it happens, and can you get like a little bit of a feedback loop to the presynaptic side. So that's at the very cellular level, and that's the endocannabinoid system that we all have living within our brains and our neuronal networks. So cool. Go ahead. I guess we have these two endocannabinoid receptors, a CB1 receptor, predominantly in the brain and nervous system, but then there's also CB2 receptors, interestingly enough, in the immune system. And I think the main focus really is the CB1 receptors, although there is interest in using some of the phytocannabinoids, so the plant-based derived cannabinoids, to address, and maybe it could be some of the off-target side effects that you might see from the other receptors throughout the body beyond just the nervous system. So yeah, take it from here.
Okay, so then if you look at the relationship between the phytocannabinoid and the endocannabinoid system, if you just click that slide. Yeah, so this one kind of shows you how they bind together. And just like you had said, CB2 isn't as much of a focus, and that's because it's a lot weaker than the CB1. And the CB1 actually binds to the THC, and it does that through the indigenous ligands, which activates them. And the specific one that activates the THC is the AEA, which is a fatty acid neurotransmitter. And then for CBD, it binds to the CB2 through the 2AG, which is also, it's a fatty acid, I don't know if I'm going to say that right, arachidonic acid, but it's a lot weaker than the CB1. So the CBD has a much weaker link than the THC does.
Yeah, so that's exactly right. So there are these receptors for which these neurotransmitters, the signals that travel between cells are called the neuronal cells are called neurotransmitters. They send one signal to another cell. And so these neurotransmitters, they bind to particular receptors. So they act as ligands to the receptor. And CBD binds with the 2AG onto a particular receptor, the CB2 receptor. And THC binds to AEA. And so basically they essentially enhance, if you will, the same endogenous responses that are going on in our brain. They may enhance, strengthen it, or in some senses weaken it. And so they're activating or slightly deactivating the existing neuronal systems that are already in our brains.
Okay, and then we're kind of looking at the relationship between schizophrenia and cannabis. And so what I started was just kind of defining what schizophrenia was, just for those who don't know. And it's, in its most basic terms, it's a very severe psychiatric disorders. And typically your symptoms fall within three categories. You have positive symptoms, which are things like hallucinations, delusions. You have negative symptoms, which are when you're unable to express emotions, or you have difficulty in keeping up with activities or even starting activities. And then you have cognitive deficits in working and verbal memory. And typically, the more severe your negative and your cognitive deficits are, the more marked disability is. So the more severe your schizophrenia is.
Yeah, I think this slide is really important just in general about schizophrenia because, and it's relevant to a particular interest of mine is that the autistic population, because historically, autism had been thought of as a neuropsychiatric disorder similar to schizophrenia, where there's this sense that maybe these kids who have autism are living in their own world, they're hallucinating a world inside of their minds. And then they also have these negative symptoms where they have difficulty empathizing with the people around them, and they might at times have staring off spells and a flattening of their affect. So so both these positive symptoms and negative symptoms may exist to varying degrees in autism. Now we fully well know now, I think it's incorrect to classify an autistic child as schizophrenic or having these sort of hallucinations. But the reality still exists that they do have these kind of obsessive and repetitive thoughts, and maybe the way they're processing the sensory stimuli around them is very different than the typical child. And so having a basic understanding of what is schizophrenia and how it differentiates from autism and where there might be a potential overlap in some kids is important too. So tell us about the studies.
Okay, so for schizophrenia, in this article, it kind of covered on schizophrenia the most. It had the most research for it. So there's a lot of things that I kind of wrote down, and then I kind of summarized the most important points in the next slide. But just to kind of go over what they were talking about. So they found that patients that had schizophrenia or that were using antipsychotic treatment, they had elevated levels of AEA. And if we remember from the previous slide, AEA is what was AEA, THC is what binds to AEA. So they felt like there was some link over there. And then they also found that CB1 was found in the cortical regions, and they thought it was maybe linked to schizophrenia. But what they found overall was that THC was linked to an increased risk in developing schizophrenia, especially if they started using cannabis a lot earlier in their lifetime. And the reason for that was because THC has, again, a psychoactive component of cannabis, and so it was responsible for the whole psychotic outcomes and the hallucinations and stuff like that. CBD was found to actually block the psychotic symptoms induced by the THC, and this was done by directly inhibiting the reuptake of AEA, so it wasn't allowing more AEA to be created, so it increased the serum levels. So THC was kind of looked at as starting it, and then CBD, the CBD proponent of it, was kind of looked at as blocking that psychotic psychosis or hallucinations.
Yeah, this is a really fascinating aspect of this paper where it gets into what is the neurochemistry of schizophrenia. So those people that have schizophrenia, one of the theories is that they have an increased number of CB1 receptors in particular regions of the brain. And in those particular regions of the brain that allows like intense visualizations, maybe auditory imagination to be activated. And so the theory, as far as the literature suggests, that those people who have an increased number of those receptors are more prone to having these symptoms genetically because of their high number of receptor burden there. And then if they then start using cannabis, then they have now an increased amount of THC, which binds to those areas and somehow activates some cycle that now they might experience these hallucinatory symptoms that schizophrenic patients do. They have the psychosis in absence of the THC. So basically they go on to develop into schizophrenia, that somehow the THC activates some genetic predisposition to it, and then they go on to have it. That's one of the theories of why schizophrenia kind of exists. And interestingly enough, so cannabis has both of those components, has the THC and the CBD, and the THC tends to activate the CB1R receptors, CB1 receptors, and then the CBD has an inhibitory effect, and that maybe could CBD use then as a conclusion that if we extract the CBD out because it has an inhibitory effect, then maybe the CBD can then be used to treat folks that have had cannabis exposure and then went on to develop schizophrenia, or just schizophrenics in general. It's a really fascinating thought or suggestion from the authors.
So this kind of just summarized, because the last PowerPoint slide had a lot of information. So this kind of just summarizes everything, where it's just said that THC is said to increase the psychosis symptoms. CBD is said to reduce the symptoms by inhibiting the reuptake of AEA, which is what binds to the THC. And then early use of cannabis is said to greatly increase the risk of schizophrenia.
All right, great.
So then we have anxiety, which again, I just kind of went through and just talked about what anxiety is. And so anxiety is a chronic disabling condition, and there's several syndromes that kind of fall into the category of anxiety. You have generalized panic, social anxiety, obsessive OCD, and then PTSD. It's one of the most prevalent mental illnesses in the world, and typically you would take something like antidepressants or benzodiazepines, and but out of all the patients that take it, they found that 40 to 60% do not attain total relief from the symptoms that come from anxiety.
Yeah.
So then anxiety was something that they'd already actually tested on. And so this was kind of what we already knew about just the effects that cannabis had on patients with anxiety. And what they found was that typically with lower doses, it would help in reducing their anxiety. But when they took higher doses, it would increase their anxiety. They weren't sure which part of the plant, or like whether it was like the THC or CBD was affecting that. That's kind of what the next slide we'll talk about, because that was more current research. But they did recognize the fact that when you took lower doses, it would help reduce it. It was higher doses where you would kind of have that increase in anxiety. So this was the more current research, and this is where they found that the THC was the one where if you took it at low doses, it would help reduce it, but at higher doses, it would increase anxiety. It was the CBD that, regardless of how high or low of a dose you took, it would always help in reducing your anxiety. And they had neuroimaging studies that helped show that effect, and how it was how certain areas of the brain were involved in the control of their emotional processes. And then when you took them together, so when they were co-administered, regardless of how high dose the THC was, the CBD was usually able to reduce that anxiety and the effect that the THC caused as well.
Yeah, it's fascinating. So even kids who have autism, they may have a comorbidity of anxiety where their thoughts are so overwhelming, and that are certain situations, because one of the core features of autism is kids, they have these social deficits, they have trouble communicating, they're just so much difficulty in even just making eye contact that can be an overwhelming experience for them. And so there is a level of these recurrent thoughts, these subconscious recurring thoughts that prevent them from engaging in a healthy way with the world around them. And so that can look like anxiety. I've had a number of kids that were just so overwhelmed with the sensory stimuli, it's like they couldn't focus on the world around them, that so it kind of looks like anxiety, or these thoughts were processing so fast and so frequent, it affects their sleep, it affects them from engaging with their family members or their loved ones, and it's just so overwhelming. And so THC, interestingly enough, could potentially, you could have some receptors that respond to CBD and THC, but then this kind of bleed over, where if you have too much of the THC, it then causes an increase in anxiety because it's now bleeding over into the other receptors. But it is really fascinating to say, if you remove the THC entirely out of the picture and you just have somebody being given CBD, then it may have more of an anxiolytic effect. And that kind of reinforces the idea of really, if somebody's being medicated with cannabis, that they really try to extract out the THC for the purpose of the anxiety component and really give more of the pure CBD as possible, which is harder to do. It takes an intense chemical process to do that. All right, so depression.
All right, so then we have depression and cannabis. And again, I started off by just defining, I'm going through overview of what depression was. It's one of the more debilitating psychiatric disorders. It affects about 20% of the population. And it can sometimes be characterized by sadness, emptiness, loss of interest, impaired concentration, or even decision making, insomnia, or psychomotor agitation. And then typically first line treatment for depression would be stuff like antidepressants. But again, same thing, where not all patients are able to receive full remissions, and many are even unresponsive.
There we go.
Okay, so the current research that they had with depression, it was kind of the one that it's definitely still in works. So it wasn't as defined as anxiety and schizophrenia was, but what they did found was that with females that were diagnosed with major depression, there was a reduction in their serum content, specifically with their CBD or their 2-AG. But then they found that their AEA, which is the one that binds to THC, wasn't very significantly altered. Something else they noticed was that those who consume cannabis occasionally or even daily have lower levels of depression symptoms than those who have never tried cannabis. And the THC typically affects the amygdala, which is responsible for the regulation of emotions. So they feel like there could be a connection there with the fact that our amygdala is responsible for things like our emotions, our fear, our anxiety, and the THC is directly affecting that. So those who use marijuana can sometimes get a sense of paranoia or pain of some sort.
Yeah, it's fascinating. I think there's still a lot more research to be done in the realm of depression, and could CBD play a part? I think it's hard to say here.
So then I kind of went through just key points that we kind of just covered overall. And that's just how heavy cannabis could be associated with the occurrence of psychiatric outcomes, especially in the realm of psychosis or with mood disorders. We see that THC is kind of the main psychoactive component of cannabis, and it's the active ingredient that is responsible for both psychotic or effective mental health outcomes. And then CBD represents the non-psychoactive component, and it's said to have antipsychotic properties that help to, do things like reduce anxiety. CBD also has the potential effect to help in the treatment of psychotic and anxiety disorders. Again, depression is still kind of, we're in that gray area where we don't really have the research to prove anything yet. And then I just kind of at the bottom was like THC, not as recommended, but CBD, you can kind of see the benefits of where it could be recommended for things like schizophrenia and anxiety.
Yeah, that's awesome. So I really appreciate you kind of that article, sharing that article and giving that overview. I think the big takeaway for anybody that's interested in the clinical applications of cannabis is to know that there's two main psychoactive components, the THC, and then as I'm calling psychoactive as well, as CBD. And because they both work on receptors in the brain. And if some people, they say, oh, well, we can just kind of self-medicate. We can start getting cannabis. And because part of the problem is, as these new medications come out, medications that have CBD in it, they're going to be very, very expensive because it requires an intensive process to extract out just the CBD and remove any of the other impurities or the other psychoactive components like the THC and just give pure CBD. And so people that might be inclined to obtain their own cannabis and self-medicate, they may be actually putting themselves at harm because they're activating the wrong receptors, thinking that there's some added benefit. And this also reinforces the idea that if you're seeking out products that may not have the appropriate concentrations, or you're unaware of the right concentrations, that the doses do matter of the medications that you're getting. So if you're, again, seeking out CBD from an unknown supplier and you don't know what other things they've added to it, because there's a lot of hemp oil just mixed in, then you may be doing yourself greater harm, or not actually doing adequate treatment for the condition that you're looking to treat. So a lot of this really has to be studied to a great extent, and it's hard to say is the same efficacy going to be there in the adult population versus the pediatric population, because these receptor numbers and densities are going to be different in kids than they are in adults, and places in the brain that the mature brain is going to look different versus the maturing, developing brain. So very fascinating stuff, but I'm an advocate for doing things as much as you can in a systematic, scientific way. So thank you, Hannah. Thank you. That was an excellent article. I really appreciate you going over through that.
No problem.